From time to time, I hear about a certain product or dietary ingredient that develops a bit of a bad rep for patients that are trying to conceive, for patients that are going through with reproductive disorders like polycystic ovarian syndrome, for example. And one of these products that I often get questions about is soy. Soy-based products, soy-based extracts. Are they bad or are they good or are they neutral for patients that are trying to conceive? And so a new research paper that looked at all the clinical trials, observational, prospective trials, looking at soy intake and their impact or correlation with fertility and reproductive outcomes, first of all found that there's really poor quality evidence to suggest that soy has an impact on things like menstrual cycle length or potentially hormone levels. So there's really no clear evidence to take away, make a conclusion that it has a either positive, negative, or neutral effect. And the research so far suggests that it seems to have either a neutral or potentially positive benefit for some specific patient subpopulations. And we'll talk exactly which patients might potentially benefit from using things like soy-based products or soy-based extracts. So first of all, soy is a culturally very rich food that's used in South Asian diets, vegetarian diets, and in Asian diets, and now is widely available in North America as well, and has become easily a very easy to include a source of protein for a lot of vegans and vegetarians. So it's quite concerning for patients when they are told or when they read about or when they hear, through the grapevine that soy might actually be affecting their fertility in a negative way. So first off, no clear evidence to show it's actually going to have a negative impact on your fertility. So you don't need to get panicked or worried about your soy-based intake. And if you use soy in your diet, you're probably okay to keep continuing to use it. There are certain subpopulations where they saw soy might actually be of benefit. And when we look at soy, it's not just the food itself, it's all the incredible ingredients that it might include as well. And that can often include isoflavones, it can include certain phytochemicals and other bioactive compounds. So we have a multitude of ingredients that can exert some sort of a physiological benefit potentially for patients that are trying to conceive. So there's a couple of studies that looked at specifically the extract of isoflavones from soy, and they used a very specific dose in these studies, and they followed patients that were doing assisted reproductive technologies like intrauterine insemination or in vitro fertilization, so IUI or IVF, and they actually found patients that used the soy based extract compared to patients that didn't use it seemed to have a higher implantation rate and a pregnancy rate. And there are some studies also suggesting that taking soy-based products was actually associated with an increase in the thickness of the uterine lining, particularly for patients that were 35 years of age or older. So again, these results are quite limited. The number of studies are small. The population that they used in these studies is quite small. We're talking like 100 to 150 patients per research paper in some of these ones that we're discussing. So there are no way in-depth, profound, we definitely need more research on this topic to clearly identify if soy is beneficial for particular subpopulations like this or not. But the early research here is suggesting a potential positive impact of using soy-based products, or more specifically here in these studies, a soy-based extract of isoflavones in a very specific dose. And another patient subpopulation group that seemed to potentially have an improvement in their cycles and treating amenorrhea, so the absence of cycles, were actually patients with polycystic ovarian syndrome. So there was a trend where patients with PCOS, if they had more soy-based products, they actually might be related to seeing more increased regular cycles. But again, very limited research. The main takeaway that I find from this research that we have available so far is it's really nothing to be concerned about if you're having soy-based products, most likely if for most patients, and it's not something that you have to avoid. There are occasionally patients who have certain food sensitivities that, eating a product like soy, for example, just causes a lot of digestive upset, or may aggravate things like irritable bowel syndrome. So obviously, if you find it to be aggravating for you, it's probably not a good idea to include it. But if you're using soy-based products on a regular basis, and it's your main source or one of the main sources of protein for you, there's probably more benefits to taking soy in general for a good, healthy dietary source of protein, potentially some benefit for patients with PCOS or patients that are going for IVF or IUI. And the reason why they think things like soy might be beneficial for patients that are trying to conceive is in these particular studies, they were given a medication called Clomid. And Clomid actually reduces the impact of estrogen on the uterus. So it can actually thin the uterine lining to a certain degree for some patients. And the isoflavones found in soy-based products can mildly stimulate estrogen receptors. So that's the hypothesis that the researchers provided, that taking a high dose of isoflavones may potentially help to counteract the estrogen or the uterine lining thinning effect that a medication like Clomid can have. And potentially a thicker uterine lining may be why we're seeing that these patients that were taking the isoflavones were actually seeing a higher pregnancy rate and higher implantation rate as well. Again, hopefully we have some bigger studies, and these studies were probably moderate quality that we're discussing, although they were small, but they did have randomization, they did have a placebo control group. So those are things we always like to see in studies. They help us to better assess if there's a causative effect as opposed to just some correlation, which is, I think, where a lot of dietary studies fall short on. They can often establish correlation, prospective trials or observational studies, but not necessarily causation between, does taking a certain ingredient actually cause the benefit or change we're seeing, or is it totally something else, some sort of confounding variable. So these studies actually included a placebo group, and it was better controlled. And better quality studies were also suggested by the researchers in this big review to help assess if this trend that we're seeing, this improvement in pregnancy rates, does continue to appear in future trials as well. So if you're trying to conceive, if you're concerned about things like soy, definitely have a conversation with your healthcare provider first before making any changes, and not just going off of something you read on the internet, but you want to speak with a licensed healthcare provider to see specifically for you, is there potential benefit or is there potential harm for you for using something like flax or soy or other sources of these phytoestrogens.